Today we're talking to Dr. Ben Brown, who is our Chief Medical Officer at Patches Health, and he's also incredibly a practicing GP and a senior lecturer at the University of Manchester at the same time. So Ben, you wear several hats. What led you to join Patches Health? What was the appeal?
Well, myself, Dan and Marcus started Patches Health a few years ago now. We were we met through my job at the university. I was doing and still am doing research in AI and software and how we can use that to improve healthcare. And Dan and Marcus were interested in doing the same, and we were put in contact via my PhD supervisor at the time, and we spoke about wanting to use technology to improve care for patients, and we found that that was something that we all three of us were really keen on, and we came up with different ideas about how we could use AI in particular for patients' benefits and for clinician benefits and staff benefits as well. And Patches was the idea that we came up with that gained traction, and it's essentially about, can we use AI to support patients getting quicker care from the right people, but also reducing workload and reducing administrative burden on healthcare staff. And that's the mission that we're on. And I think we're making good progress, but lots more to do.
Great, thank you. So, what can you tell us what your day looks like? What do you do? What do you actually do for Patches Health?
So as Chief Medical Officer, I am kind of the key target end user, and I use Patches in my GP practice. So I am really focused on making the system work for practices and patients. I know everybody actually has that ultimate goal, but I'm kind of focused on end user experience. So what features do we need for staff and for patients? Is it useful? Is it designed in the right way? So I will lead on designing the features and making sure that they're useful for the end users. I'm also responsible for clinical safety, of course. So as a piece of software that's used in the NHS, there are lots of safety standards we need to adhere to and regulations, and that is my job to make sure that we follow those rules, and Patches is as safe as it can be. So that's another part. The other big area that I focus on is the medical device regulations. So as AI is a medical device when it's used in healthcare, for healthcare, there are medical device regulations again that we need to adhere to, and so it's making sure that the AIs are safe, they're tested, they're evaluated in a rigorous way, and that they're documented and registered with the appropriate bodies. And linked to that, clearly through my work at the University of Manchester, we do a lot of research as well into Patches. So we want Patches to be evidence-based and have rigorous backing of research evidence. And so we conduct lots of research studies into Patches, including the AI bits, but also what the wider functionality of Patches. And I also lead on that, and how that can and how the university can work with Patches Health.
You may have covered this already, but have there been any particular projects or elements of the work that you found particularly interesting, exciting?
So, I mean, as someone who kind of who started Patches and kind of has an overall view of it, I've really enjoyed every part of it. I mean, the most rewarding thing and enjoyable thing for me is to actually build software that I use, in my daily practice when I'm working as a GP, but also to speak to patients and find out that they've used the software and it's really helped. So I that whole thing is it's really amazing to build something and use it yourself and see the benefits, but also hear from other people, other GP practices and clinicians that it's useful. So I you know, that overall it's a really enjoyable project to be part of. The other bits that I find really interesting is the AI. So all the different AI modules that we have and the different projects, particularly when we've done it in a as we've done it in a rigorous way, that kind of aligns with my research approach as well. And the reason why I think the AI bit is so interesting is because it's you know, it's modern and cutting edge, but at the same time we're doing it, you know, we're doing it more than any other. We're kind of leading the way in the NHS in terms of using AI. I'm not aware, you know, I'm an expert in this area, and I'm not aware of any other system that's used in primary care and GP practices that uses AI apart from us. So it's really exciting to be on the kind of avant-garde of this new technology.
Okay, thank you. So how would you describe the workplace culture at Patches Health generally?
So Patches Health is a really friendly place to work. So everybody is super friendly and approachable. There's definitely you can talk to anybody about anything. So it's a very nice place to kind of make friends and colleagues to work alongside. You know, everybody works hard, absolutely, and everybody's focused on achieving objectives. There's flexibility as well within the workplace. So I would say it's a very, although there are periods of intensity and there's always a focus on making sure that we're building a good product, it's definitely relaxed, and it's a fun place to be with. There's really clever people at the company who are just nice to talk to and also learn things from, so that there's such a wide range of different skills and backgrounds of the people that work here. It's really stimulating, you know. I know that sounds cheesy, but it's really nice to talk to different people and find out and learn things from the skills that they have.
Nice. And finally, if you were thinking about the kind of qualities that somebody needed to have to fit in with the team, so if somebody was thinking of applying, what would you say they are?
So if you are thinking of applying to Patches Health, first of all, I'd say please, you know, do it. It's a great place to work, and I'm sure you'll enjoy it. We've not had anybody not work here and not enjoy working here. I think, you know, the key things are to be friendly and approachable to fit in with everybody here. Of course, you need to be hardworking, but the thing I think that you need to be most motivated by is making a difference in healthcare. So making a difference for patients, of course, but also the staff that use the software as well as the patients. So as long as you've got that drive and that ultimate aim to want to make a difference in healthcare using cutting edge technology, then this is the place for you.
Brilliant. Thanks so much for your time today, Ben.
Pleasure.